Let's bring in Anne-Marie. She's at home. Oh, there you are. Good to see you.
Good, not frozen.
You're not frozen. You are live.
You're frozen too.
No.
That's Kelsey.
Oh, nice throwback. Well done, Ben. Here's another throwback. Speaking moistly, a lot of people wanting to wear or choosing now to wear masks, you know, if you're a moist talker or if you just feel like it would give you better protection or help to protect other people. Lots of debate around whether or not to wear masks. Different health organizations have different recommendations. The WHO, as of today, is still saying homemade or non-surgical or cloth masks are not recommended in any circumstance. They still want you to wash your hands and physically distance. The CDC in the United States, they were one of the early adapters saying that they recommend wearing cloth face coverings, in public settings where social distancing is difficult, especially in areas where there's community spread or outbreaks, which we know there are a lot of cities in the U.S. experiencing this right now. And then our own public health agency, Canada Public Health, and our Chief Medical Officer of Health, Dr. Theresa Tam, they also changed their recommendations. As of April 7th, this is what's on the website. Wearing a non-medical mask, example, homemade cloth mask, in the community has not been proven to protect the person wearing it. However, the use of a non-medical mask or facial covering can be an additional measure you can take to protect others around you. And the protection they're talking about is if you are either pre-symptomatic, so your symptoms haven't shown up yet, you're shedding the virus without any of the typical symptoms we talk about, or you are asymptomatic, and there is concern around this kind of transmission where you have the virus and you're not showing any symptoms. So if you are choosing to wear a homemade or a cloth mask, a non-surgical mask, here's how the WHO recommends that you put it on safely for it to be effective. Have a look.
Fit the mask on your face. Pinch the metal strip or stiff edge so it holds to the shape of your nose. Adjust the mask over your face, covering your mouth and chin, making sure there are no gaps between your face and the mask. Do not touch the front of the mask while using it.
Another important tip about that is to make sure you wash your hands before and after you put on the mask. And here's the most important one. Do not touch the front of the mask. It is contaminated. I saw a guy in public do this yesterday. He had a mask, pulled it down to say something to somebody, and then put it back. So not only has he touched the dirty part of the mask, the front part, he's also put it near his nose, which is why there was so much caution around recommending wearing masks in the first place, and this idea of false security. Probably just as important, if not more important, is how to take off the mask safely. Here's what the WHO says.
To take off the mask, remove the elastics from behind without touching the front and keep it away from your face. Discard the mask immediately in a closed bin and clean your hands.
All right, so in the circumstance, if you're wearing a homemade or a cloth mask, you wear it only once and you wash your hands when you take it off. You can also wash these masks, but it is really important to remember to only wear it one time. And one final note, you know, the doctors we've spoken to on this program, medical officials I've talked to have all said the same thing. We want this physical armor, this physical protection, but masks and gloves are only stage 2. The most proven, the most fail-safe way to keep yourself clean and to keep yourself healthy, wash your hands and physically distance. Because if you're more than 2 meters away from someone, you don't need a mask. So there you go. Just some tips on if you are going to choose to wear them, how to do it safely.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.